My lady, these are the submissions of the Trades Union Congress. Our written submissions and these oral submissions focus on what my clients see as the pitfalls of this module's narrow focus on restricting attendance at schools, the school closures point, and this module being a missed opportunity to properly examine and learn the lessons of how to keep schools fully open safely. We raise it as relevant to the list of issues, to the evidence gathered, and to the issues to which attention is given in the hearings, and we note that we speak as one voice with several other of the core participants. By way of summary of the concerns as to the focus on the decisions to restrict attendance at schools, first, we detect a creeping presumption that to restrict or not to restrict school attendance is always a meaningful choice, but that presumption is a false one. One of the few sure things about the next pandemic is that the characteristics of the virus will be different to the last. The characteristics of the virus precipitating the next pandemic in terms of transmissibility and lethality and other physical consequences may well be of a nature that unrestricted attendance at schools is either not at all realistic or not at all necessary. So in that context, anxious and narrow focus on the issue in the specific context of COVID-19 is really an exercise in preparing for the last pandemic rather than the next. Second, though restricting school attendance quite clearly has significant and adverse impacts on children, an overly simplistic steer from an inquiry that those impacts weigh heavily against restricting attendance risks being positively harmful. Now is not the time to rehearse some of the considerations examined in Module 2 as to the epidemiological management of a pandemic. However, it is clear that effective pandemic response in terms of low deaths and limiting long-term impact across society, including for children, may best be served by early action. Firmer and earlier non-pharmaceutical interventions may lessen the impact in the long run. And in our written submissions, we point to the example of New Zealand, which acted early with an early lockdown and ultimately far less disruption in schools. As we have observed elsewhere, in the COVID-19 pandemic, the seeds of chaos in schools were sown with a keep schools open at all costs approach going into the autumn term of 2020. And that resulted ultimately in a series of late, chaotic and counterproductive decisions in relation to schools over the following year. In pandemic response, bold and early may be the way forward, but bold and early may be frustrated by school restrictions either being taken out of the toolbox or being put in the category of absolute last resort. Third, in focusing so closely on the impacts of restricting attendance, the impact of the counterfactual of unrestricted attendance has a tendency to be lost. As in our written submission, it has been estimated that 13,000 children in the UK were orphaned by the pandemic. Children are not insulated from death rates across society or the local hospital or care home being overrun. Keeping schools open at all costs may have costs for children also. It's the Peter Pan point made a few moments ago. There are also, of course, the physical consequences of infection on children in terms of fatalities, hospitalizations, long COVID, all of which will inevitably be different and possibly even greater in the next pandemic. Fourth, keeping schools fully open as safely as possible is surely the most worthy and most important of objectives. It maximises the opportunity for unrestricted attendance and limits the harms to both pupils and staff of being fully open in the midst of a pandemic. There is also the point that parents exercise choice as well as governments, as the clinical vulnerable families observe, and parents need to have confidence that schools attended by their children are safe. Casting one's mind back to the COVID-19 pandemic, safety in schools was such a vexed issue. Masks were variously of no use or of some use, were an optional requirement, a mandatory requirement or not advised. An array of social distancing measures were prescribed in corridors, in classrooms, in bubbles of various shapes and sizes. Restrictions on attendance were visited on different year groups at different times, sometimes on a rotated basis. Sometimes attendance was staggered. Little was done to address the physical limitations of school buildings in the context of social distancing. Ventilation was rarely at the forefront, notwithstanding its importance. Schools were turned into mass testing centres at a moment's notice. Exams were cancelled in a manner that exacerbated the harms of doing so. Those various issues were characterised by Herculean efforts of teachers and other staff, by uncertainty and often harm for children, and of mixed and dubious effectiveness. That raises a question. In the next pandemic, will safety measures in schools suffer from the same unfortunate characteristics? The TUC and its affiliated education unions are concerned that they will, and that this module is not focused on addressing it. One answer to these observations might be that Module 2 was a module concerned with decision-making, and this, in contrast, is an impacts module focused on the impact on children. That does indeed appear to be the approach, but the consideration of decision-making in education in Module 2 was limited, and this module is the last and important opportunity to address these issues. Ms Dobbin, King's Counsel, touched on these issues this morning, and one of her observations was that this, quote, cannot be an inquiry about how the entire school system can be future-proofed against a future pandemic, unquote. My lady, respectfully, we say that is problematic. Is it not the case that future-proofing against a future pandemic is precisely why we are here and why this inquiry exists? The observation really demonstrates our point. We say that focusing narrowly on restricting school attendance doesn't really help the education sector prepare for the next pandemic, but the Modulate team says that is not what this module is about. In other modules, this inquiry asks, unashamedly and in fulfilment of its terms of reference, how can the health sector be better prepared for the next pandemic? How can the social care sector be better prepared for the next pandemic? How best can we as a nation be prepared for the production of vaccines and for a test and trace system? And it should, in our submission, also ask, how can schools and the education sector be better prepared for the next pandemic? And that must include how to operate them safely. We do welcome the evidence being gathered on ventilation as described by Ms Dobbin this morning, but we say that is not in itself sufficient. Broader expert evidence is necessary, which studies and brings together the evidence and considers the lessons to be learned, and on a far broader range of issues than ventilation, though that is important. And we say that there needs to be a committed focus on these issues at the hearings. My lady, those are the submissions for the TUC.
Thank you very much indeed, Mr. Jacobs.